Ingat pesan ibu, pakai maskermu, cuci tangan pakai sabun, jangan sampai tertular. Ingat selalu pesan ibu, jaga jarakmu, hindari kerumunan, jaga keluargamu.
I'd like to welcome the professor. Did you just miss? You may have just missed my recap over your career. This is Ed Davies from President of the Foreign Correspondents Club. I just wanted to welcome you today and thank you very much for coming for a second talk with us in a matter of weeks to this very important role and at a very important time for Indonesia. So I'd like to hand over to you, and I think you had a video or a presentation.
Okay, thank you very much for your introductions. First of all, I'd like to extend a warm welcome to all of the respected journalists who are joining here today. And I'd also like to express my sincere gratitude to JFCC for hosting this event. Friends and colleagues, this month marks 7 months since Indonesia detected its very first COVID-19 positive case. Similar to other countries that are facing this pandemic today, this virus has proven to be a tremendous challenge for us. Nevertheless, despite it all, Indonesia has also witnessed heartwarming acts of resilience, inventiveness, solidarity, and kindness. Let me start by updating you on COVID-19 cases in Indonesia as of this week. We have detected 63,365 positive cases in this country. In the meantime, 437 patients have recovered, equivalent to 76%, and currently we rank 19th out of 216 countries in terms of recovery rates. I believe that our consistent efforts will ensure that recovery rates continue to increase. Without further ado, I will now answer some of the questions from the media.
Test. Okay, Professor, the first question came from Victoria Milko from Associated Press. The question is, we've heard the government plans to administer vaccines to certain groups starting in January 2021. Is Biopharma currently producing a COVID-19 vaccine? If so, which vaccine and what is the current stockpile of the vaccine?
Okay, thank you for the questions. Sinovac, in collaborations with Biopharma and Pajajaran University Medical Faculty, is conducting clinical trials for the vaccine. And this vaccine is currently undergoing phase 3 of clinical trials in Bandung. Biopharma predicts that the Sinovac vaccine production capacity can reach up to 250 million ampoules by the end of 2021. In parallel, to support their targeted production capacity, the Merah Putih Vaccine Consortium is also attempting to produce a domestic vaccines by working with local companies that can potentially produce this vaccine in the near future. This effort is aimed at ensuring that all Indonesian citizens are able to access this vaccine should they need more than one vaccination.
Okay, second question came from Wahyudi Surya Atmaja from the Straits Times. Can we have the latest update of the vaccine trial, Biopharma and Sinovac, and efforts to secure more supply of possible vaccines from other companies in Europe or another from China, Sinopharm? Any update from the Biopharma Sinovac phase 3 clinical trial in terms of safety? Are there any negative reactions reported from volunteers taking the vaccine candidate?
Okay, thank you. Presently, the Indonesian Food and Drug Authorities, or BPOM, is monitoring the third phase of the Sinovac vaccine clinical trials by the Biopharma in collaborations with Pajajaran University from the Faculty of Medicine. This phase of the clinical trials has involved 1,620 volunteers in Bandung, and per September 2020, 1,089 recruited subjects have had their first injection administered, while over 450 subjects have had their second injection administered. Thus far, there have been no reports of adverse side effects in the clinical trials. And the Indonesian government's primary aim is to ensure vaccine availability for the Indonesian citizens to achieve herd immunity. This herd immunity is really the immunity that received by the public because of the vaccination. To fulfill this large requirement, the government is actively looking for COVID-19 vaccine sources. However, Indonesia will remain selective in choosing these vaccines, including Sinopharm and other pharmaceutical companies, to ensure that when it enters Indonesia, it is already proven to be safe and reflected in the data and research results, as it will be injected into millions of healthy people. In parallel, the multilateral collaborations, the government of Indonesia also continue to encourage domestic vaccine development, such as Merah Putih Vaccine Development Consortium led by Eijkman Molecular Biology Institutions and the Ministry of Research and Technology.
Okay, the third question came from Edward Davies from Reuters. Why are Indonesia's testing rates still so low per head of population compared with other countries in the region like the Philippines or India? Surely testing is the only way to ensure that social restrictions can be lifted and there is some way out of this crisis.
Thank you from Reuters. Per this week, the number of the national tests have reached 189,358, which is equivalent to 70.13% of WHO recommendation. We acknowledge that testing in Indonesia, which is 12,948 per 1 million citizens, is below the Philippines, which is 35,887 per 1 million citizens, and India of 58,596 per 1 million citizens. However, comparisons between these countries must be made carefully given the challenges in various aspects are completely different. Consider the Philippine population. It is significantly lower than Indonesia. Moreover, India is not an archipelago. Geographic conditions, among others, must be taken into considerations. Provinces such as Jakarta and West Sumatra have surpassed WHO recommendations by 6 and 2 times respectively. And to date, 376 laboratories are available in Indonesia, 265 with the RT-PCR laboratories, 76 with the TCM laboratories, and 35 laboratories providing both services. We strive to strengthen testing in several ways, including encouraging regions to increase their laboratory testing capacity and also performance. Testing is a method recommended by the WHO to provide an overview of the size and extent of the COVID-19 cases in Indonesia, which must also be accompanied by tracing and treatment as continuum of care. However, any lifting of restrictions is subject to behavioral change that would later reduce the number of the transmission rates. The 3T, testing, tracing, and treatment efforts will not end the pandemic if it's not supported by the public awareness and compliance with the health protocols. Both the 3T and the health protocols are prioritized equally and need to be run simultaneously.
Okay, the fourth question came from Natalia Santi from Australian Financial Review. What is the development of virus strains in Indonesia? How many types or what types of strains have been found? Does a strain affect symptomatic and asymptomatic patients differently? And is it true that the new COVID virus strain is deadlier?
Okay, thank you. During the vaccine development process, the whole genome sequencing studies in every country should be done regularly to determine the characteristics of this virus. Study results must be reported to the GS8, Influenza Virus Data Bank, for further analysis. And Indonesia has submitted 34 sequences from SARS-CoV-2 genome, and 24 of them have entered the analysis and characterization stage. Generally, the characteristics of viruses existing in Indonesia are similar to those spreading in Asia. And the analysis result state that 9 whole genome sequences contains the D614G mutation that has been known to dominate approximately 78% of the global SARS-CoV-2 virus. And the president of the G8 has stated that there is no evidence to prove that this mutation is more virulent or dangerous and is considered to not interfere with the vaccine development. Therefore, I wish to inform the public to remain vigilant as we do not know when the pandemic will end. And the most important effort the public can make is to ensure a new disciplined lifestyles with stringent health protocol. Thank you.
Okay, the fifth question came from Kate Lam, Reuters. Jokowi had optimistically suggested that up to 180 million doses of a COVID-19 vaccine would be available by the end of next year. But vaccinating millions will invariably be a complicated and logistically challenging exercise in Indonesia. Could you walk us through the country's current vaccination plan? Realistically, given the country can only test about 30,000 people a day, how many people does Indonesia think it can vaccinate by the end of 2021?
Okay, thank you, Reuters. Indonesia is ensuring the availability of vaccines to reach over 80% of the population, higher than even regular vaccinations, in order to achieve herd immunity in Indonesia. So Indonesia is collaborating with other vaccines producing countries while developing a vaccine in Indonesia independently. We are currently finalizing a vaccination roadmap plan that involves cross-ministries and stakeholders. At this stage, we are preparing priority vaccines according to vaccine availability, the large populations that we have, the stage and index of use. In addition, we are also estimating the platform scheme and target cluster priority groups with various considerations, especially from a transmission risk aspect. From a logistical perspective, we are working to calculate the availability of the human resources providing vaccinations and also the cold chain services according to international standards. In the implementations of a national vaccination, we are developing an inclusive service network, such as local governments, private and government-owned healthcare providers, down to the posyandu levels, professional organizations, armed forces, and also police, as well as gatekeepers to ensure that the vaccination process is well received by the public. Thank you.
Okay, the next question came from Lucy Godot, AFP. There are actually 4 questions, Professor. The first one is, what is the situation in COVID-19 hospitals in Jakarta and Surabaya at the moment? How full are ICUs in these 2 cities? The second question is, does Indonesia have enough doctors and health workers to face this crisis? The third question is, when do you expect the epidemic to reach its peak in the country? And the last question is, when do you expect to be able to start massive vaccination campaigns? Will the vaccine be halal?
Okay, thank you from AFP. So presently, Jakarta has 98 units and Surabaya has 21 units of COVID-19 referral hospitals. We expect these numbers to increase in the upcoming weeks. And in Jakarta, the use of the bed for isolations is up to 72%, while ICU is also 72%. The isolation centers are enough, but the Jakarta local government is still working to increase the room capacity for other medical actions like surgery and hemodialysis. For data regarding availability of bed, especially in Surabaya, kindly ask about this development to the local government officials. Nevertheless, these hospitals have seen an increase in bed capacity each day to ensure that the hospital can quickly deal with the infected patients who require urgent care. East Java, as a province, has referral hospitals in each district and cities. In addition, this week, East Java has no more high-risk or red zone areas, this is a good performance of East Java. And according to data from the Board for Development and Empowerment of Human Resources of Health under the Ministry of Health, there are 225,299 health workers spread across 755 referral hospitals in Indonesia. The government of Indonesia continues to strive for equal distribution of health workers while ensuring their rights are taken care of, either through severance pay or intervening by providing free swab tests. And the peak of the pandemic cannot be predicted, we know that. Predicting said peak is not what is most important, but the effort undertaken to end the pandemic is what is important. And the vaccine development normally takes a long time, and we hope that the vaccinations can be done immediately, provided it passes the phase 3 clinical trials with satisfactory results to receive approval from monitoring agencies. And we must stick to that data. presently, various agencies are looking to determine the halal aspect of the vaccines. Thank you.
Okay, Professor, the last question came from James Masola from the Sydney Morning Herald. Indonesia reported 307,122 infections and 141,169 suspected cases on October 5th. Only 4 of 34 Indonesian provinces are meeting the WHO's minimum target of 1 person tested per 1,000 people of population. It has now been more than 6 months since the first COVID case in Indonesia. The first question, when will Indonesia meeting the WHO minimum standard? And the second question, if Indonesia had reached the minimum standard, how many more infections would the country have?
Thank you. We continue to compensate for the delay. Assuming our 267 million population, the WHO target would result in 267,000 people getting tested per week for PCR. And our commitment to ensure testing is reflected in the increase in the number of the national weekly tests. Per this week, the number of the national tests have reached 1,809,358, which is equivalent to 70.13%. And quantifying the direct relation between testing and increase in number of cases is not possible. However, it is certain that testing followed by limiting close interaction will result in the suppressions of the new cases. Thank you.
Okay, thank you. I'm sure we'll have some follow-up questions there. One question I just quickly wanted to ask was, Jokowi did talk about the peak being September, which, I don't know, looking at caseload, that doesn't seem to be the case. So I know you didn't want to predict a month, I can understand that, but are we looking into next year now for the peak?
When we discuss about the peak of the pandemic, it's related to the behavior of the people. So when we want to predict the peak of the pandemic for Indonesia, and I'm sure this is also for other countries, what we need to look for is how the public really change their behavior. If their change of the behavior is slow, then the peak will be slow reach. So therefore, we are working hard to really change the behavior of the public. And now we are starting to monitor real time on the behavior, and we will update you in the near future about the progress of that. Thank you.
Okay. I think there looks like there's a follow-up from Victoria Milko of AP. I don't think we can get her on, right? She's without audio capacity, but her follow-up question is it correct that as of right now, Indonesia currently has no finished doses of any coronavirus vaccine prepared? And when is it expected that the vaccine roadmap might be available to the public or the media?
Yes, the roadmap plan is being developed and has been discussed within the government, and we will update you when it's ready and it's final.
Okay, and it's correct that obviously there aren't any finished doses of vaccine prepared.
Not yet.
Okay, thank you. Are there more questions out there? I just wanted to follow up on the testing. Obviously, wouldn't it be ideal to have, I know you mentioned that obviously making comparisons can be difficult between countries, but wouldn't it be ideal to have a much higher number of tests in order, to get a better picture of the COVID outbreak in Indonesia?
Sure, I agree with you. We are working hard to improve the testing capacity, especially in the 10 provinces that we put in priority. And it has been increased very well. But again, we want to make sure that this process is also followed by other areas as well. So, and from time to time, we will inform you in terms of the performance of increased capacity of the laboratories, especially in the areas where contributing the high number of the cases.
Okay. All right. We've got a question. I'd just like to open up the line, if I can. How do I do that? Hold on a second. Right. I think you should be on.
Okay. So thank you for the questions from the media, and please allow me to...
Sorry. We have a question here, I think. Can you...
Okay.
Yeah. Hello?
Yeah.
Yes, hello.
Yeah, you had a question.
Yes, Prof Wiku, thank you very much for your time. I would like to ask, how is the public reacting to the government's providing hotel rooms for isolation? Has there been any increase that there are the needs for people to isolate in separately from their homes? And how is the occupancy so far in the hotels that the government has been providing for isolation wards? Thank you.
Thank you. At this moment, the hospitals have been the destinations of the people who need care, and we provide the hotels in several provinces to make sure that the capacity is provided for the number of the cases if those hospitals cannot handle it. For example, in Jakarta, there are thousands of beds ready when the Wisma Athlete emergency hospitals and also the towers over there are full. But to date, we don't need to have that since the Wisma Athlete still can handle that capacity.
Thank you, Prof.
Okay, you're welcome. So I think this is the end of the questions and answer. And please allow me to extend my appreciations to everyone today. To close, I'd like to summarize everything that the government has been doing in its COVID-19 management efforts. Concurrent to our main objective is to change the behavior of the public and promote the importance of the health protocols as the most effective preventive measures in curbing the spread of the virus. And the government is also working hard with numerous international and national research institutes and pharmaceutical companies to hopefully obtain both preventive and curative approaches to fight COVID-19, which we have spoken about earlier. Although we understand that the vaccines will provide a glimmer of hope and an important long-term tool for controlling COVID-19, the government believes that we must focus on three main aspects to save the lives. First, the government is putting in maximum efforts to promote health protocols and make it into a new normal by ways of establishing a change of lifestyle. That includes physical distancing, overall hygiene, coughing etiquette, self-isolation if necessary, wearing masks at all times, and only sharing information from reliable sources. Second, effort in suppressing transmission. Several steps we are continuing to do it, tracing and quarantining contacts. The most important intervention for breaking chain of transmission is not necessarily high-tech and can be carried out by a broad range of professionals. The government at all levels, police, military, and community organizations are continuing its best effort to improve its surveillance and contact tracing systems to prevent new cases from emerging. Third, we will always prioritize saving lives. Early identifications and clinical care undoubtedly save lives. Providing the appropriate medications to people with severe and critical disease save lives. Paying special attention to high-risk groups or those with comorbidities, including elderly people, also save lives. 6 months ago, none of us could have imagined that we would face such a challenge. But behind this challenge is also an opportunity to emerge as a community that we want to be. As I mentioned earlier, there has been numerous cases of people supporting other people, demonstrating the growing sense of humanity. Persistence and creativity are two features commonly found among the people as well. This only goes to underscore the sheer amount of things that can be achieved during an emergency. Once again, thank you for joining me today. Stay safe and healthy, and until we meet again. Bye-bye.
Thank you, Professor. For any follow-up questions, I presume we can.
Ingat